There are moments in senior life when families are forced to make decisions fast. Parent falls, a spouse has surgery, a loved one is hospitalized. Someone becomes weak, confused, or unable to return home safely. Then the hospital says the words many families are not prepared to hear. Your loved one may need rehab, or we need to discuss skilled nursing placement. And suddenly the family is expected to make a serious decision under pressure. Which facility? How soon? Is there a bed? Does insurance cover it? Is it safe? Will the therapy be good? Will anyone call the family back? Will the senior recover or decline? Too often families are handed a list of facility names and told to choose. We know that is not enough. Not when the decision affects safely, when it is life-altering, not when it affects recovery, not when it affects your dignity, and not when it affects whether someone gets stronger, weaker, neglected, confused, sent back to the hospital, and unfortunately, perhaps worse. This is Senior Power. I'm Joel Cushing, and today we are introducing a tool we developed to help seniors and families think more clearly before choosing a skilled nursing or rehabilitation facility. We call the application Senior Rehab Finder. Its purpose is simple. Do not choose rehab blindly. Ask better questions. Compare more carefully. Verify what matters and protect the dignity, safety, and recovery of the person you truly love. Senior Rehab Finder is a custom AI-based assistant created to help seniors, spouses, adult children, caregivers, and families research skilled nursing and rehabilitation facility options. It is not a hospital system. It is not a facility. It is not a government agency. It is not a discharge planner. It is not a doctor. It is a decision support and research tool. That distinction matters. Senior Rehab Finder does not make the decision for you. It helps you prepare to make the decision. It helps organize the questions families often do not know how to ask. It helps users think about facility selection in a more structured way. It can help you focus on issues like location, staffing, ratings, therapy, safety, family communications, inspection concerns, discharge planning, and whether a particular facility may fit the senior's actual needs. When families are under pressure, structure absolutely matters because panic is not a plan. A printed facility list is not a plan. A nice lobby is certainly not a plan. A quick recommendation from someone who does not know your loved one's full situation is not enough. Senior Rehab Finder is designed to help you slow the decision down mentally, even when the system is moving fast. Most families do not study skilled nursing facilities until they are already in a crisis. That is the problem. The hospital stay happens first, the discharge discussion happens next, then the family is asked to choose. But skilled nursing and rehab decisions are complex and complicated. Families may not understand the difference, even, between short-term rehab and long-term nursing home care. They may not understand what Medicare may cover and what the insurance has approved. They may not know which facilities are in the insurance company's network. They may not know what therapy services are actually available, and they may not know how much staffing matters to the well-being of the person who's going to be in the facility. They may not know what to ask about falls, infections, pressure wounds, medication, food, cleanliness, or hospital readmissions, and frankly, perhaps worse. They may not know that nights and weekends can be very different from weekday daytime staffing. They may not know what to look for during a tour. They may not know how to compare facilities beyond distance from home, which might be the least important factor. And they may feel that they do not know. But there is no reason to be embarrassed. The system is difficult. It is full of jargon. It moves at lightning speed. And families often face it at the exact moment when they are tired, worried, and emotionally overwhelmed. The Senior Rehab Finder exists because families need a better starting point. It's not a guarantee. It's not a magic answer, but it is definitely a better starting point. So I would say that Senior Rehab Finder is for seniors who want to prepare before the need for rehab emerges. It is for spouses trying to understand what may happen after surgery or hospitalization, for your adult children who are helping the parents, for the caregivers who need to organize the questions. It is for families who have been told that a loved one may need skilled nursing care after a hospital stay. It is for people trying to compare facilities. It is for people who do not know what to ask. It is also for families who want to plan before the crisis drops. That may be the most important use of the tool. If a surgery is scheduled, use it prior to the surgery. If a parent has repeated falls, use it before the grand emergency occurs. If a spouse is becoming weaker, use it before the discharge planner is standing there waiting for an answer. If someone is at the risk of needing rehab, start learning now. The best time to understand rehab options is before the crisis. And the second best time is today. I'm just going to briefly touch through this because in the workbook, which you will pick up and we will provide to you for free and no obligation, we'll go through this obviously in great detail. But basically, we're going to make it very easy through a link to access the software. It'll be placed in the YouTube description and in the pinned comment to this podcast. When a viewer clicks the link, it will open the Finder in what is called ChatGPT. And for this, you may need to log in and even create an account, which is about a 2-minute thing maximum. And again, it doesn't cost you anything. Once the tool opens, the viewer can type questions or even speak to it directly into this chat. It's like dealing with a live individual. You'll get a kick out of it. It's very exciting. So this is important. This is not a video. You simply watch and forget. It is a tool you can use and which you should use. You can ask it questions. You can describe situations. You can ask for checklists. You can ask what to ask at the hospital or what to ask at the rehabilitation facility, and even ask it to compare the options and what to look out for in terms of the red flags. So the instructions are simple. You'll click the link and out will pop the application. You'll start with just putting in the city and state you are interested in finding the rehabilitation facility in. Then you will describe the care situation, and you're off to the races, so to speak. When you open the Senior Rehab Finder, it just starts simply. You might type, I am looking for short-term rehab facilities near Scottsdale, Arizona, or my mother needs rehab after hip surgery near Boca Raton, Florida. What should I ask before choosing a facility? Or, my father is being discharged from the hospital after a fall. He needs physical therapy and help walking. We are looking near Tampa, Florida. So the basic starting point is, what city and state are you interested in? But the tool becomes more useful when you add context. For example, my mother had a stroke and may need physical therapy, occupational therapy, speech therapy, or my husband has mild dementia and needs rehab after a hip fracture. Perhaps my father is weak after pneumonia and may need skilled nursing before returning home. My spouse needs wound care and therapy. What should we ask before choosing a facility? Note that the more clearly you describe the situation, the better the tool can help you organize your thinking. You do not need to use fancy language. You do not need to know medical jargon. You can write the way families actually talk. My mom is weak and we are worried about falls. My dad gets confused at night. My husband wants to come home, but I do not know if he is ready. My sister and I disagree about which facility to choose. These are real situations. Senior Rehab Finder is meant to help with those situations. The system can help you organize the rehab selection process. It can help you think about what matters before choosing a facility. It can help generate questions for the hospital discharge planner. It can help generate questions for facility admissions staff, and it can help prepare a checklist for touring the facility. Furthermore, it can help to compare several facilities using the same categories, and it can definitely help in identifying and documenting the so-called red flags. It can help you think through the senior's actual needs and help the families move from panic to structure. For example, you could ask, what should I ask before choosing a rehab facility? What should I ask the discharge planner? What should I ask the admissions director? What should I look for when I tour the building? And what are those red flags? How do I compare 3 facilities that I've just visited? What questions should I ask about therapy? What questions should I ask about staffing? And what should I think about asking regarding falls? Okay? And how about the infection control at the facility? Is it adequate? Should I ask about discharge planning? How much is there of it? How much depth did I go to? So therefore, the tool can help turn a confusing situation into a series of practical questions, fundamental questions for which you need the answers to. And that's the point. Better questions lead to better decisions. One of the best uses of the Senior Rehab Finder is preparing for the hospital discharge conversation. Hospitals move quickly. Families may feel pressured. A discharge planner may be trying to solve multiple cases at once. You're not alone. That does not make the family's questions less important. Before speaking with the discharge planner, you can ask the Senior Rehab Finder, what questions should I ask the hospital before agreeing to a rehab facility? The tool may help you prepare such questions as, what are the medical reasons rehab is being recommended? What level of care is needed? What therapy has been ordered? Does the patient need physical therapy, occupational therapy, speech therapy, wound care, medication management, or nursing care? Which facilities are available? Which facilities are in my insurance company's network? Does Medicare or insurance cover stay? How many days are expected? What happens if coverage ends? Can we choose a different facility? Can we appeal a discharge decision? What records will be sent to the facility? Who manages medication changes? Who should the family contact after the transfer? Those questions are not rude. Let that sink in. They are responsible when a loved one is being moved from a hospital to a facility. The family has a right to understand what is happening. The finder can also help before calling rehab facilities. Instead of calling and saying, do you have a bed, you can prepare a somewhat better list. You might ask, for example, what should I ask a rehab facility before choosing it? Then use those questions during a call. For example, do you currently have a bed available? Can you handle this person's specific medical needs? What therapy services are available? How often is therapy provided? Is therapy available on weekends? How do you communicate with families? Who is the family contact person? How do you handle medication changes? What happens if the resident declines? How do you prevent falls? How do you handle confusion, dementia, or nighttime wandering? What is your discharge planning process? How soon after admission does therapy begin? How often does the care plan get updated? Can the family attend care planning meetings? What should we bring on admission day? These are practical questions for which you definitely need the answers. All of them. They help families hear whether this facility is organized, responsive, and prepared. Sometimes the way a facility answers questions tells you almost as much as the answer itself. How true. A facility tour can be misleading if the family doesn't know what to look for. A nice lobby does not guarantee good care. Fresh paint does not guarantee good staffing. A friendly admissions person does not guarantee strong therapy. Before touring, ask Senior Rehab Finder, what should I look for when touring a rehab facility? Then take a checklist with you. Look at the entrance, but do not stop there. Look at the hallways. Look at the residents. Look at the staff. Look at the interaction between the staff and the residents. Listen for unanswered call lights. Notice whether residents seem clean and attended to. Notice whether staff greet residents by name. Notice whether staff seem rushed or dismissive. And to see the therapy area, ask how therapy schedules are created, ask how the progress is measured, and what happens if the resident refuses the therapy. Who does communicate progress to the family? What about meals? What about medication management? What about falls and about infection control? Ask about discharge planning. Ask about matters of nights and weekends, because care does not only happen during the rehab finder can even help to create a comparison checklist or table. This matters because families often compare facilities emotionally. One person says, this one is closer. Another says, this has better ratings. A third says, this felt nicer. And then another, the hospital recommended this one. Now, they may be all relevant, but they are not enough. A better comparison must include issues like distance from family, the insurance coverage, facility ratings, staffing, inspection results and concerns, therapy availability, medical services, and so on and so forth. And does it fit the actual senior? You can ask the finder to create a comparison table or checklist for 3 rehab facilities, or even help me compare facility A, B, and C, or even what categories should I use to compare skilled nursing facilities. This kind of structure can reduce family conflict. Instead of arguing from emotion, the family can compare real issues, perhaps not perfectly or automatically, but certainly more clearly. Let's walk through an example on how to use the system. Let us say a father is in the hospital after a fall. He is weak. He cannot walk safely. The hospital says he may need short-term rehab. The family is worried and does not know where to begin. They open the Senior Rehab app and type, or even speak to it, "My father is being discharged from the hospital after a fall. He needs short-term rehab near Tampa, Florida. What should we ask before choosing a facility?" The tool can help organize the next steps. That's what we're trying to show them. Then the family might ask, what should we ask the discharge planner? And then what should we ask the facility, the nursing facility administrator? What should we look for during the tour that we're going to make? And then please create a comparison checklist for 3 of the facilities we will visit. Okay. From this and other information, what are the red flags that we cannot ignore? That is how we will use the system. It will be step by step, question by question. It does not eliminate hard work. It makes the hard work more organized. And when a family is under pressure, organization truly matters. The Rehab Finder can also help families talk to each other. That's important because facility decisions can create conflict. One adult child wants the closest facility, another wants the highest rated facility. The spouse wants the place recommended by the hospital. Someone else wants the place a friend used years ago. One other is worried about cost. Another is worried about distance. Another is worried about therapy. Another is worried about whether the senior will be lonely. That's a lot of worries. These are real concerns, however, not to make fun of any of it. The Senior Rehab Finder can help the families create a common checklist instead of arguing. Arguing is certainly counterproductive in this case where we're running out of time. And the family can ask, what does the senior need medically? What therapy is required? How important is distance? Who will visit? What insurance limitations exist? What facility has the right services? What questions must be answered before admission? What would be a deal breaker? What does the senior want? There, seem to have forgotten all about the senior. Those questions can shift the family conversation from panic to planning. That does not mean everyone will agree, but it does give everybody something better to discuss, and therefore having a much more productive result. Our channel exists because seniors and families need practical information they can use. Not hype, not fear, not sales pressure, not vague advice, real tools, clear questions, better preparation, more informed decisions. The Senior Rehab Finder fits that mission because rehab and skilled nursing decisions are often rushed, emotional, expensive, confusing, and consequential to the nth degree. A poor decision can affect recovery, it can affect safety, it can affect whether someone returns home. Yes, it's that serious. It can affect family stress. It can affect dignity, and certainly you'll agree that dignity does matter. A senior entering a rehab is not just a patient. That person is a spouse, a parent, a grandparent, friend, neighbor, veteran, worker, caregiver, or community member. That person has a history. That person deserves to be treated with respect. Choosing a facility should not be treated like picking a name from a list. It deserves thoughtful questions. It deserves verification. It deserves senior power. In summary, a rehab decision can happen fast, but fast does not have to mean blind. A family may not be able to control the hospital schedule. It may not be able to control bed availability. It may not be able to remove all uncertainty, but it can ask better questions. It can compare more carefully. It can prepare before making calls, before touring, and allow you to keep your eyes open. It can verify what matters. You can use it to protect your privacy, help keep your dignity, and that is why we created this system. Use it before a crisis if you can. Use it during a crisis if you must. Use it with a spouse, with an adult child, a caregiver, but use it before calling facilities. Use it before touring. Use it before accepting placement. And then you can all do all this by having it build your own tailored checklist. Use it to ask better questions. The link is in the description and pinned comment. Again, we appreciate the time that you have spent with us, and we look forward to continuing our relationship. We will see you in the next episode. Take care.